Imagine being able to treat deep-seated traumas, treatment-resistant depression, and anxiety with substances that, until recently, were associated with parties and counterculture. What if I told you that what was once considered dangerous and illegal is now revolutionizing modern psychiatry? That's right, psychedelics, once demonized, are now opening new doors in the treatment of serious mental health conditions. Let's explore how these substances are transforming medicine and why this might be the solution many have been waiting for. Psychedelics have always been surrounded by mystery, prejudice, and fascination. Substances like LSD, psilocybin, found in so-called magic mushrooms, and MDMA were long associated with the hippie movement, mystical experiences, and even self-destructive behaviors. But over the last decade, science has decided to give these compounds a second chance. And what did they find? Huge therapeutic potential. These substances, when administered in a controlled way and in clinical environments, have shown impressive results. Studies conducted by renowned institutions like Johns Hopkins University and Imperial College London have revealed that psychedelics can help patients with severe depression, post-traumatic stress disorder, PTSD, and substance dependence when other treatments fail. What makes these substances so effective is the way they affect neuroplasticity, the brain's ability to reorganize itself. Psychedelics act on serotonin receptors, especially 5-HT2A, which is involved in regulating mood and perception. This can open up new connections in the brain, allowing patients to revisit traumatic memories in a safer way and process these emotions from a new perspective. For example, MDMA, which in recreational doses is known as ecstasy, is being used to treat PTSD, helping patients confront their traumas without overwhelming emotional pain. By reducing the fear response, patients can access painful memories without the same level of distress. We are living through a true psychedelic renaissance. In the 1950s and 60s, they were researched for treating mental health conditions, but the wave of prohibition in the late 60s abruptly halted these studies. Now, with a shift in mindset and new research emerging, governments and institutions are starting to reconsider their stance on these substances. Recently, the US FDA granted psilocybin breakthrough therapy status for depression, speeding up the research and approval process. This paves the way for us to potentially see these substances being prescribed in the near future, in a controlled and supervised setting at specialized clinics. Psychedelic-assisted therapy is not just about using the substance. The process is carefully monitored by mental health professionals. During a session, the patient is placed in a safe environment, often with soft music, and encouraged to relax and surrender to the experience. The therapist is present to help guide the patient, processing emotions that arise during the journey. After the session, there's a crucial integration phase, where the patient reflects on their experiences and how to apply them in their daily life. This integration process is fundamental because that's where the true healing work happens. One of the most fascinating aspects of psychedelics is how they connect science and spirituality. Many people report ego-death experiences, where they feel a deep connection to the universe and something greater than themselves. This type of mystical experience, when well integrated, can be a powerful tool for personal transformation, helping heal traumas and reconnecting with the meaning of life. Studies show that these mystical experiences are strongly correlated with better therapeutic outcomes. In other words, the deeper the spiritual experience, the greater the chances of success in treatment. Despite all the potential, it's important to remember that these substances are not a silver bullet. Their use should be approached carefully and always supervised by trained professionals. There are risks associated with recreational and uncontrolled use, such as psychotic episodes, increased anxiety, and the risk of triggering underlying mental health issues. However, when used in a controlled environment, the benefits seem to outweigh the risks. With the expansion of studies and positive results accumulating, we're seeing more and more countries relaxing their laws on psychedelics. Countries like Canada already allow the use of psilocybin for therapeutic purposes in certain cases, and it's possible that others will follow suit soon. The expectation is that, in the not-too-distant future, we may see specialized clinics where psychedelic treatments are offered in a regulated way, providing a new approach to problems that affect millions of people worldwide. If you enjoyed this content and want to continue exploring topics as interesting as this one, follow the channel and activate notifications so you don't miss any of our upcoming videos. See you next time.